Welcome to Hit Exchange Media, coverage of the HIMSS 11 conference in Orlando, Florida, where attendees are talking about health information exchange and interoperability.
Once you can exchange your information between organizations or within an organization, the next stage that organizations typically want to go to is to be able to view that information in an integrated way, particularly for clinicians at points of care. And that's really where our next solution comes from, around kind of a, for a hospital or for an enterprise to be able to do. And we do that by being able to integrate the information from disparate systems, into a single view for clinicians, where they can be using a patient-centric view at points of care to be able to improve quality of care and patient safety and all those things. So we can do that at a hospital level or kind of an enterprise level.
Okay, good.
Then the next thing we do is then we can do that across multiple organizations, for example across an HIE, where we're able to exchange information across multiple organizations, and then where necessary, depending on the models that want to be used, we can again allow clinicians to be able to view data, or we can extend it out to allow referring physicians to be able to do things, or to be able to allow primary care physicians, for example, to be able to use the application to be able to do things around basic functionality that they need in part of their practice. So we can see how we can expand that out, having started from integration and moved up through the hospital and then through across healthcare exchange.
That's great.
Our core business grew in other industries first. I think primarily because those industries were more open to standards. They had more of an integrated approach to how they worked with IT, where in the healthcare industry it was definitely much more siloed and segmented by department. Only now that you're trying to implement meaningful use, EMR standards, health information exchanges across outside the boundaries of the hospital, are the concepts of standards and open integration and a services-oriented architecture becoming paramount to succeed in that area. That is who Software AG is. That is what we do. We do it for the largest corporations in the world, and now we're doing it for healthcare.
You're watching Hit Exchange Media, coverage of the HIMSS 11 conference in Orlando, Florida. Catch the premiere issue of Hit Exchange magazine or visit hitexchangemedia.com for more healthcare technology news and information.